How many?
Okay. Maternal adaptation to simply starts with this one. Oh God, this slide. Okay. Maternal adaptation to they're giving birth. Okay. This is Reva Rubin was around when I was in school, so this theory has been around for a while. So what they're saying is when a woman gives birth to a baby, she will go through certain stages or phases. Usually, the first phase is called taking in, and this is right after she delivers the baby. The patient needs others to meet her needs. So she's taking everything in. She's taking the whole birthing process in. This has a baby. She's seeing the baby for the first time. She's a little bit needy in this phase because of the fact that she's tired and overwhelmed and everything like that. So she is taking in and she is reliving the birth process. So what happens to her with this taking in? She tells everybody, my water broke, then my husband drove me to, she relives it. Oh, she tells housekeeping the whole story over and over. You're on the phone telling the story over and over again. So the taking in phase is usually what we see right after she delivers for at least the first day or so. She's needy, but she's reliving the whole birthing process because of making it real, okay? Taking hold phase is the second phase of after she delivers. This is usually seen maybe the day she's going home, and it will continue this phase a couple of days after she gets home. This second phase is characterized by her being dependent and starting to be independent. So usually we say the best time to teach her about the baby or about taking care of herself is during this taking hold phase. She's taking hold. She can start to learn about how to care for the baby. If you tell her the first day she's not processing it, she's just processing the regular process there. So this is when she's a little bit independent and dependent, but she is willing to start learning. The letting go phase is the third phase. It might happen like a month after she gets home, in which the woman reestablishes relationships with others. So, she's reestablishing a relationship with her husband or maybe other children in the house. The letting go phase, and it doesn't say it here, is letting go of the fantasy of that perfect baby that you may not have had. Maybe she has 3 girls at home and was hoping for the fourth one to be a boy, and it turns out to be another girl, or the opposite. So she lets go of her fantasy. She's letting go. She wanted a vaginal birth, but she ends up having a cesarean section. So at this point, she comes to terms with the baby, her birth, the baby's birth, and reestablishes a relationship with family members and her spouse. I'm looking at it I guess I should have looked at it beforehand. I'm thinking, how different can it be? Okay. So the postpartum period is usually 6 weeks after that's the time of delivery of the placenta and the baby and all that, and the first 6 weeks after delivery. Again, this is a critical transition period for women, newborn and family, both physiological and psychological. It's like having a big elephant in the room. I mean, here you might be a couple. You're so used to just going out to dinner when you feel like it. You want to have sex, so do whatever you want. Now you got this big elephant in your room called a newborn, right? And what happens is you have to I got to get a babysitter. I can't just run out and buy a pair of shoes, or I have to bring. It's winter. You have to, bundle the baby up, warm the car up in advance, and bring a bottle if you bottle. So it's you have to plan at least a half hour if you're bringing the baby with you, just to get everything ready, the diapers and all that stuff. So it's a transition. So psychologically, and even for the husband, it's a very big transitional time. Do you know that men go through postpartum depression? Did you know that? The study's showing that men will go through postpartum depression after the baby's born. And although they focus on the woman all the time, the man is also going through all these changes. Here he used to have this, vivacious, sexy wife, and let's go to dinner, let's have fun, and now she's got a breastfeed. I remember those days, that's what I'm saying. like, I remember my husband, when he'd come home, he was a doctor, but he was doing his residency at the time. And he'd come home, and I'm home with the baby, and she was up every 2 hours around the clock, breastfeeding. Every 2 hours. I was a walking zombie, right? And he'd come home, and he said, "What's for dinner?" I'm like, "Dinner?" Oh my God, he wants dinner. So it's a big adjustment. It really is an adjustment for the husband, for the wife, and the sibling. New sibling who comes into the household. That sort of it changes. So anyway, so it's an adjustment psychologically and physically also. Peripartum, which is really postpartum, because it's hard to say that word. Is a period after delivery for about 6 weeks. This is when what they call involution of the uterus. That's not saying in another slide, but what happens is the uterus will start to go back to its old size, and it takes about 6 weeks, okay, for it to occur. So when we feel the fundus after she delivers, each day the fundus should go down 1 finger breadth each day. Okay, that the top of the uterus should go down. On day 3, it should be 3 finger breadths of 3 centimeters below the uterus. By day 9 or 10, you can't feel it anymore. It's all the way down into the pelvic cavity. So that is what you normally want to feel each day. Hospital definition changes in all aspects of the mother's life that occur during the first year following birth. And again, all these changes. Okay. Uterus is an involution occurs. You'll feel the contraction of the muscle fibers the first few days after you give birth. You feel contractions, particularly when you're breastfeeding, there's a pitocin, and this is trying to get your uterus back to its old self. Okay, so you have cannibalism of the uterus, regeneration of the uterine epithelium, the inner lining of the uterus, and then lochia. Okay, lochia is the blood that comes out after the woman delivers. You probably have this in lab already. First 3 days, it is lochia rubra, red. Okay. After the first 3 days, it's serosa, sort of brown and reddish color. This lasts about 3 days. This could last for about another 3 or 4 days. And then after that is alba, white. Okay. And the alba is usually lasts another like 2 weeks or so. Okay. It's not uncommon for that afterbirth pains, as I talked about. It's uterus getting back to its old size, and it's usually you feel it when you had a large baby, or if you have twins or triplets, or this is your second or third baby. It gets more stretched out it gets, the more afterbirth pains you have, so it's trying to get back into what it was before. And again, if the woman is breastfeeding, she will feel these pains when she breastfeeds because pitocin is being released from the brain. So that causes contraction here. The cervix closure is now occurring. It has a jagged slit-like opening. The vagina eventually will thickening will return and return of rugae to the vagina, and then the perineum needs to heal if she had any kind of laceration or if she had an episiotomy. And this again shows you how she should progress each day. So that's the umbilicus. That's where you feel the fundus the first day. And then this is that's day of delivery, which is day 1 finger breadth, 1 centimeter, and just each day. Look where it is, but by day 9, it's already in the sacrum. Okay, so it's just really low. The cervix in a woman who never had a baby looks like this, round. And a woman who's had a baby, it's smiling. No. It's happy cervix. I had that baby. Okay? So when the person gets an exam, she's never had a baby, she's going to look round. And if she did, smile more. Okay? More like a slit. It's a slit-like versus a round one. Okay? This following treatment after birth, the cervix returns to its pre-pregnancy shape.
False.
After delivery, the cervix closes but never regains its pre-pregnancy appearance. It is no longer circular, but it appears as a jagged slit-like opening like you just saw in the Okay. Given things that are adapting, the blood volume, the cardiac output, it takes a few weeks for all of this to start settling back to what it was. When a woman's pregnant, her blood volume or her blood volume goes up about 50% in the pregnancy, so that it can fuse to the uterus and the fetus. So that will remain up for a couple of weeks after she delivers. Her cardiac output is usually higher during the pregnancy. That will also take about a couple of weeks for it to get back to what it was beforehand. Her hematocrit level should be within a normal range, okay? Might be a little bit lower because she might have lost 500 mLs of blood or 1,000 mLs of blood. So again, they always take the woman's CBC after she delivers. Remember, you have to know those values for the test, blood count. Her pulse rate will decrease after she delivers. She gets a little bradycardia. The blood pressure should remain the same as it was before she delivers. Her coagulation factors are increased when she's pregnant, okay? After she delivers, there's still increase for the first few weeks. So it puts her at risk for thrombosis. These coagulation factors are still elevated for the first couple of weeks. Her red blood cell count should remain the same. Is the following statement true or false? The drop in maternal blood volume after birth leads to a similar drop in hematocrit. False. Despite the decrease in blood volume, hematocrit levels remain relatively stable and may even increase, reflecting the loss of plasma. And then the urinary system adaptation, the glomerular filtration rate and renal flow will start to increase. Her voiding sensation will depend on if she's able to feel like she has to urinate or not. If she has tears or swelling or any kind of hematoma, she may not feel the urge to urinate. There could be decreased bladder tone because of her anesthesia. The diminished sensation of bladder pressure due to swelling or bladder tone, numbing effects of anesthesia. So she may not feel initially the first few hours after she delivers the need to urinate, but they really want her to urinate usually within 6 hours of delivery. Okay. And another thing, it's a very interesting thing that happens to women also, is after they deliver, they have this 50% more plasma volume in their system. So what happens to her after she delivers is she starts to urinate like crazy. Okay, like she has 2,000 mLs of urine coming out at one time because her body's getting rid of that extra fluid she had. She had 50% more plasma volume when she was pregnant. The body has to get rid of it. So she will have diuresis, is the term they use when they start to lose fluids. There is also a large amount of IV fluids that she had during her labor, so that will be coming out. Decreasing antidiuretic effect of oxytocin as it levels decline. So she had Pitocin, and it caused a little bit of that water retention. Now that she doesn't have it anymore, she's going to have to urinate. And then the extra fluids, there's a decreased production and aldosterone within acid. And again, she will urinate and she will sweat, perspire. Okay. So the woman will wake up, usually it's at nighttime for some odd reason. The woman will wake up in the middle of the night and be soaked. She has to change her gown, change the sheets, all this, because her body's getting rid of the fluid. So the body will perspire, her body will urinate. Okay. The GI system quickly returns to normal. There's, again, none of the pressure of the fetus on the organs. There can be decreased bowel tone for several days. Decrease in her peristalsis when you listen to the bowel sound. Not here is being as active. Constipation is common due to the fear of straining. That might cause, she always thinks she's going to rip something. She had an episiotomy or tear, but it's never happened. But you feel that, like, oh my God, if I go, I'm going to, something's going to rip. Okay. So a lot of times they'll give her stool softeners, okay, to help her do something at nighttime for her stool softener. She's hungry and thirsty because she's been NPO before she delivered during her labor. So a lot of times they're like, "Where's the food? Get me some food right now. I'm so thirsty." Okay, so so it's not unusual to see that. Her musculoskeletal system will start to, again, she's been stretched out. Will start to return. Okay, and then the joints will also, return to normal, except everything except for the feet. This is what I tell people when they get pregnant. I used to buy shoes because I thought, oh, I'm not going to buy those frumpy clothes, you know. And they had that. I had pictures of me with little shirts and bubbly little tops. And like, oh my God, it's like, my kids are like, what ugly clothes you wore when you were pregnant. Sort of, we didn't have the stylish stuff they have now. And I used to buy shoes and all that. What happens is they say your foot size never gets back to what it was after you have the baby. So your foot size, let's say you're size 8 to begin with, you're going to end up being an 8.5 perhaps after you deliver the baby, or size 9. Okay. So again, don't buy too many shoes because you're going to end up throwing them out or giving them to someplace.
The shoes are good for it.
What's she saying?
Women commonly experience fatigue and activity intolerance for the first few weeks after they deliver. It's the body's adjusting, getting back to normal. You lost your blood, you had a baby. The baby has you up all night, so you're going to be tired. Your abdominal muscle tone might be a little bit diminished after birth, and there'll be special exercises that are needed to return to normal. Just like, sit-ups a little bit, sit-ups, or even trying to tighten your muscles, pulling it in, can sometimes help. Your skin, a lot of times when a woman's pregnant, if she has a mole, it becomes darker, okay? Or she might even get moles that she never had before when she's pregnant. And because of melatonin, there's an increase in melatonin, her nipples will get darker, her moles will get darker, she'll get that, we talk about linea nigra, which is that dark line from her belly button down to the pubic area. You see the darker skin unit, that should start to fade. Stretch marks will fade to silvery lines. Again, the diaphoresis, meaning the sweating, is common for about a week after she delivers. Okay. Respiratory volume, it will return back to its pre-pregnancy values 1 to 2 weeks after birth. Again, the anatomical changes will come back quicker because think about it, the baby's been here and impinging on the woman's diaphragm, and she has a hard time. She will run out of breath. She, more difficult breathing. Baby's gone. She can breathe. Baby's out of her. Endocrine system, estrogen, progesterone levels drop quickly. Placental hormones decline because there's no placenta. And prolactin levels decline within 2 weeks if she's not breastfeeding. So prolactin is prolactation, meaning that helps the woman make milk. Okay, and if she's not breastfeeding, she will have those prolactin levels decrease. She is able to be maintained. Okay. And lactation is when the woman decides to breastfeed. The secretion of milk by the breast is a result of an interaction of progesterone, estrogen, prolactin, and oxytocin. Okay? All this will cause the women to make milk and to be able to feed the baby when milk comes out. Okay? Typically, appearing 4 to 5 days after childbirth, you're going to see the real milk that she's going to have. It's like almost like a white, like a little blue tinge to it. Restful process. I have no idea what that is. You can look that up. Restful. What's that? Yeah.
So it's sort of like you just place the baby on her abdomen.
Yeah.
And then the baby eventually finds its way towards breast.
Oh, really?
And she's not alone.
How do you know this?
Listen,
how do you know this?
Johnny boy.
well, I'll just try to practice for
Oh, okay. There you go.
Johnny.
Okay. That's cool. Okay. And this is women, again, you can see, the woman doesn't usually have a brain sticking out like that. Okay, so we're just trying to say that that
Walking Dead.
Oxytocin from the brain will cause her to have milk come out.
The last episode. In the end, there was Meg.
When he flipped out,
He saw Laurie and her face was all fucked up and shit.
Swollen, painful.
Wasn't it?
Yes,
The process of swelling of the breast
Oh,
tissue
really?
is due to an increase in blood and lymph supply as a precursor to lactation. So she might get hard as a rock, her breast might get very hard. It's relieved by frequent emptying of the breast, either by breastfeeding, if she's a breastfeeding woman, breastfeeding more frequently, and that the milk will be coming out and will be less engorged. Taking warm showers opens up, dilates the blood vessels and the milk ducts, so that can also help, allowing the baby to feed more. Cold compresses between feedings, so her milk doesn't get all filled up and gets engorged again. And then a tight supportive bra. Ice on breast in between feeding, avoidance of breast stimulation if you're not breastfeeding. So if the woman decides she doesn't want to breastfeed the baby, you tell her to wear a good bra, not to wash her nipples in the shower or do any stimulation, or else the milk will come in and reproduce. So if she doesn't want to breastfeed, good supportive bra, not to stimulate her breast. And if the milk comes in anyway, she just keeps the bra on and she can put ice on her breasts on and off because it can be painful. And usually by about 4 or 5 days it's gone. 3 days after it comes in, it's gone. Okay. For the woman who is not breastfeeding a newborn, which measures would be most appropriate to relieve engorgement?
Ice.
Ice to breast. For women who are not breastfeeding, measures to relieve engorgement include applying ice to the breast 15 to 20 minutes every hour. Warm showers would promote letdown reflux, which means the milk comes out. Okay. And then ovulation and return of menstruation. Again, these hormones that we're dealing with, estrogen, progesterone, prolactin, and oxytocin, which are involved with breastfeeding. A woman who's not breastfeeding, non-lactating woman, should expect the return of her menstruation 7 to 9 weeks after delivery. Okay, it might be a heavy menstruation, but that's the average weeks. That will be on your next test. The lactating woman, return depends on how frequently she's feeding. It could take anywhere from 2 months to 18 months for the period to come back, the menstruation to come back. Again, she can ovulate during that time, so we always say she should do some kind of backup, like a birth control device. And so let me just do, we'll stop at that slide, but I want to just do for 20 minutes or so some questions review for the test.
Okay, that's good. I like that.
Why don't we start here? Want to read the question? Let's see if we can, again, this is, figure this out. How we go along here.
So number 1, the non-English speaking husband of a client stays outside the door of the labor room with the other men in his family and refuses to go into the room during labor or deliveries. The nurse should find a candidate to carry the
You don't know the answer yet anyway, so.
Number 1, tell him that he should come in and be with his wife. 2, encourage him to come in to support his wife. 3, assess his cultural beliefs about chocolate. 4, ask the other men to make.
the most reasonable.
Tree. What?
Oh, I didn't touch this. That's what you have to do.
Oh.
That's what it is. There's something else. Okay, here. Yes, you're right. Okay, male participation in child abuse counseling and coaches. So that was it. Okay, here's the next question. So what do you think? Vertical being classical legal decision. So, okay. Contraindication for that external birth to the baby around includes the previous C-section delivery with a vertical uterine incision, cephalopelvic disproportion, conceptually, fetus, if there's a problem with the uterine sample insufficiency and ruptured membranes. So that was ready. Okay, and then next.
And this is explaining the stages of labor to a female. In describing the first stage of labor, the nurse should explain that this stage of labor lasts one dilation of the cervix to produce delivery of the fetus, two delivery of the fetus to delivery of the placenta, three delivery of the placenta to 2 hours after delivery, or four the onset of contractions and full dilation of the cervix, or
Two.
Good. All right, delivery of the fetus to delivery of the placenta, so that is the second stage. Good. Okay.
When assessing a client in labor, the nurse will measure the frequency of contractions. The frequency is measured as the time between 1. The number of the contractions in 1 hour. 2. The beginning of the contraction and the end of that contraction. 3. The end of one contraction and the beginning of the next contraction. 4. The beginning of one contraction and the beginning of the next contraction.
Four.
Yeah.
Yes. Okay, so it's the beginning of one to the beginning of the next contraction. Good.
Which term describes the pelvis with the widest anterior and posterior diameters, as well as pubic arch wide enough for pelvic. 1.
Gynecoid.
2. Anthropod. 3.
Gynecoid.
Gynecoid. 4. Platyploid.
Yeah. Remember I said it's always better. For some reason it's always better. Good.
While caring for a multi-valvular active labor who has relying on condition, the variable BR is decelerating. After contacting the science station, the interest action should be considered. 1. To return to the best side. 2. To decrease the IV fluid rate. 3. Prepare to perform a small stage on the fetus. Or 4. Use
Yes. So we have use pressure on the umbilical cord.
A client is asking about different birthing positions. The nurse should advise her that which position is synthesized in the pelvic column. 1. Squatting. 2. Sitting position. 3. Hands and knees. 4. Sitting on a work chair. I think squatting.
Squat.
Maximizing the pelvic outlet facilitates birth, which includes having more room to pass.
Squirting. Squirting. I don't want to write
Number 8.
them.
The way
I'm done
moves
writing.
The birth canal is determined by several factors, including the consistent hesitation, fetal lie, fetal attitude, and fetal position. Fetal position refers to one part of the fetus that enters the pelvic and the earth, the relationship of the fetal body parts to one another, the relationship of the wall access side of the fetus to the wall access of the mother.
The fetus moves through the birth canal to turn by slower
To the
factors.
cord causes of the mother's pelvis.
What do you think, everybody? What do you think?
I think three or
3. Oh, damn.
Yeah, I said that. I said 4.
I didn't read the last one,
The
alright?
relationship of the long axis, which is baby spine, the relationship of the baby spine to the mother's spine, is basically not, that's not what you're looking for. So the fetal position is defined as the relationship of presenting for the 4 quadrants of the mother's pelvis. For example, if the occiput is presenting in the left anterior quadrant of the mother's pelvis, the position is LOA. Okay. Let's see what else they have here. The part of the fetus that enters the pelvic inlet first is the presenting part. The relationship of the fetal parts to one another is called the attitude. And the relationship of the spine of the baby and the spine of the mother is the fetal lie. Okay.
When performing a pelvic examination on a client in labor, which pelvic landmark does the nurse use to determine fetal station? 1. Pelvic rim. 2. Pelvic outlet. 3. Ischial spine. Or 4. Ischial velocity.
What do you think?
3.
Yeah, so, the head's engaged is at where?
3.
It's just fine. Okay. That is the landmark for that. Okay, there.
Ovulation occurs at the end of this year with 1 menstrual, 2 proliferating, 3 secretary, 4 exuberant.
So if you think in terms of menstrual is the first 5 days of the cycle. Proliferation is the next 6 or 7 days of the
Just can't make
cycle.
That's 2.
Secretory, so what do you think it would be? Which one do you think? Ovulation occurs.
2.
Huh.
Because what happens is you have the menstruation for
I
about
have that in
5
the study
days.
guide.
And then after
Good shit,
that, you
Tex.
have the proliferation, which is building up the endometrial lining, okay? And then what happens is you ovulate
just
after
talked
that, and then it becomes, then it
wrong
becomes
with you?
secretory, like where it has lots of glucose and secretory, nice
Are you
stuff
done with it?
for the
Or do you
baby.
need help with it?
Okay, so that's,
No, I just have to
you know,
do.
when you want the baby to go into
chapter
that
14.
endometrial lining during the secretory phase, okay? And then ischemic is when it breaks down,
Did you start
and you get
14?
your period after that.
Did you read 14 yet?
No, I'm going to do it today.
Okay, so let's see.
I was gonna do it today too, but I gotta see the boo boo. She was disgusting.
Let's go back today.
4.
So we go.
Board.
Where I pointed out one of the landmarks.
I don't know. I just saw ischial spine.
3 is actually just like a local anesthetic.
4.
4.
Vagina block is an injection of anesthetic drug at or near the sacroiliac notch, just medial to the tip of the ischial spine. That was what I showed you on the picture that was right by the ischial spine on each side. Local anesthetic inject it into the epidural space with produce an epidural anesthesia. Local anesthetic injected through the third, fourth, fifth lumbar into space. Into the subarachnoid space is a spinal. Local anesthetic at the perineum involves 10 to 20 mL of lidocaine or 2% of whatever that is into the skin, and it's subcutaneous in the perineum tissue. So it's really like superficial. It's like if you have a mole removed, they put the lidocaine on and they remove it. So the answer is okay.
A woman is in the second stage of labor. Her husband is with her and becoming very tense. He asks the nurse, "Do you think I should leave? I feel like I'm in the way." Which response would be the most appropriate? 1, you may go sit in the father's waiting room if you want to. 2, it isn't a good idea to run out on your wife at this time. 3, why don't you get a cup of coffee and relax? You can come back later if you want to. 4, I know this is hard for you. Let me try to help you put your way through this difficult phase.
Yeah, just the way they say it. Isn't it? I think it's number 2.
I know this one.
These were just
Fuck with that, fuck with it.
Yes, 4 is correct.
Oh.
There's not a class coming.
13-year-old Sal visits the clinic for a routine examination.
Oh.
The nurse notes that she exhibits changes in her appearance
Oh.
that commonly occur during pregnancy, including an increase in breast
I
size.
tweeted my shit.
Which hormone is partly responsible for the growth and increased vascularity of breast tissue during pregnancy? A. Follicle stimulating hormone. 2. Human chorionic gonadotropin.
Gonadotropin.
3. Lactoferrin. And 4. Estrogen.
I'm saying A or
It's 1.
1.
What do you think?
1.
Oh, I was gonna say 1 or 4.
The hormone responsible for the growth of vascularity of the
I had
breast
that,
pregnancy,
but not-
I was gonna say 1 or 4.
estrogen and progesterone are also responsible for the growth of the ductal system of the breast.
There.
FSH is a pituitary hormone that stimulates the growth of the follicle in the ovary. FSH is during pregnancy, causing
Look like that
amenorrhea or
estrogen.
absence of menstruation. HCG is secreted by the fertilized ovum, and elevation of HCG results in positive pregnancy tests.
We're
gonna
go through all these questions.
Okay. In a regular 32-day menstrual cycle, the client will probably ovulate 1 on day 11, 2 on day 18, 3 on day 22, 4, 10 days after the start of the last menses.
Day 26.
The
band.
Minus
Talking about the group.
32
Day
minus
26. Never mind.
32 minus 14.
I
Okay.
ovulate on the 16th
Ovulation
day.
occurs at the onset of the luteal phase or the secretory phase. The luteal phase is in the ovary.
we get, like, the
secretory
longest
is in
question
the uterus. Okay. It's 14 days before the start of the next menses. When using the calendar method, the length of the previous 6 to 12
How wild would that be?
cycles are reported. Calculated possible range is
Crazy.
Jack, just read the next one. Read the next
18
one.
days from the length, which would be. But I would just say, basically, I would say minus
You do-
14. Minus 14. Okay. Oh, everybody knows this one. There.
A pregnant client has a small gush of clear fluid from the vagina. To positively differentiate this fluid as amniotic fluid, the nurse performs a nitrazine test. The test is positive if the fluid turns to paper. Four.
Yep. Blue.
So the smart.
That was smart.
You're so smart. Yeah.
Everyone said blue. I want to be different.
Okay.
I'm different.
A couple attended childbirth classes to prepare for labor. The nurse reinforces what they learned about breathing techniques as the woman progresses through labor. What type of breathing should the client utilize during contractions in the late phase of labor? 1. Panning breaths during contractions. 2. Slow-paced breathing at a rate of 6 to 8 breaths per minute. 3. Modified paced breathing at a rate of 32 to 40 breaths per minute. 4. Pattern paced breathing at a rate of 32 to 40 breaths per minute.
Take a guess.
I don't know.
Anybody?
Wait. 4. 2.
I knew it.
Why don't you say it?
Slow-paced breathing is recommended. This type of breathing uses less energy and is less apt to result in fatigue early in labor process. During the active stage, 4 to 7, as contractions become more painful, the woman may need to resort to faster paced breathing during contractions to maintain control. Panting generally isn't used until the transitional phase of 8 to 10. Okay. Okay, so let's see. We'll do up to 20, so this is 17.
Client is pregnant with her second child and has a history of preterm labor. She's worried that she may have a preterm labor again. The nurse explains that preterm labor may be precipitated by 1. Maternal exercise, suboptimal hydration, increased maternal activity levels, increased levels of maternal progesterone. Four.
So think about progesterone relaxes the uterus. People get progesterone shots if they miscarry a lot so that the uterus doesn't contract.
So it's not. So it's not. 3.
Dehydration is known to increase irritability. Exercise occurs during pregnancy. Decreasing
Gabby's so smart, Gabby.
Did you know that you just guessed? You guessed? Good point.
Or as shift change, a nurse reads the chart entry at the right, just written by the previous nurse. After reading this note, the nurse knows her client is Number 2.
Okay, so she is, let's see. Alright, so reading the client experience spontaneous rupture of membranes. Fluid is clear and odorless. Contractions are 15 seconds long and occur every 3 minutes. And she is 4 centimeters dilated. Okay, so what you say? 2. Okay, yes. During the active phase of labor, stage 1 of labor, membranes may rupture. Contractions last about 40 to 60 seconds, recurring every 3 to 5 minutes. And the cervix dilates from 3 to 7 centimeters. During the latent phase, stage 1, contractions last shorter and occur every 5 to 30 minutes, and the cervix is 0 to 3. And then during transition, stage 1, contractions last.
Damn, it's not coming out today.
And then before we do the last one, I just want